This is round 2. A note that we are recording this meeting. We will post the slides and the recording on our website once they are available. And we will also be documenting all the questions, and we'll post an FAQ as well. I'm Madeline Sabatoni. I'm a Senior Program Officer here at the Center at Sierra Health Foundation. This is my team on this project. Today I'm joined by Hannah Feingold, our Program Associate. But you may hear from Nora Dunlap or Genevieve Rivera throughout the application process. We are also joined today by Keith Wilson, our Senior Grant Accountant. And then if funded, you may work with Carissa Rogers and Anthony McCurry, who work on the project as well. So we're happy to have you today. Today we are going to cover the background of this funding opportunity, the opportunity itself, and then talk a little bit about how to apply. And we will have a few different times for questions, so feel free to put them in the Q&A or chat, whatever option it gives you, and we will pause to answer them a couple times. So a little bit about the Center at Sierra Health Foundation. We were launched in 2012 as a 501c3 branch of Sierra Health Foundation. Our goal is to bring people, ideas, and infrastructure together to create positive change in California. And we're really dedicated to health and racial equity. This program is under our opioid use programs department. The primary objective for this funding opportunity is to expand the availability of MUs and MNTPs through startup funds. So that to increase MOUD access for rural areas, justice-involved populations, Indigenous and Native communities, patients without transportation, and areas that do not have a narcotic treatment program or an NTP within close proximity to patients in need of NTP services. I want to really just highlight that the funds, the goal really here is to start up an MNTP or an MU. You'll see how that relates a little bit more in the budget section. So MUs and MNTPs expand access to medications for opioid use disorder treatment. This includes buprenorphine, methadone, naltrexone to patients that are unable to travel to an NTP. That could be due to geography or many other factors. In 2021, the DEA released new rules allowing DEA-registered opioid treatment programs, or NTPs, in California to establish and operate MNTPs without obtaining a separate DEA registration for each mobile component. So you can use the NTP DEA registration to operate an NTP. As a result, in California, DHCS released guidance this year, at the start of this year, related to the creation of MNTPs in California. And that guidance is available in the Behavioral Health Information Notice 24-005. We use that Behavioral Information Notice as just our guiding light, our foundation for everything. So California was the first state to create and implement medication units and has a newly established policy that allows for the creation of MNTPs. They both operate as an extension of a narcotic treatment program. So an MU, medication unit, is a geographically separate facility from the NTP with a fixed location, while the MNTPs are units that do not have a fixed location. So to operate MUs and MNTPs must be connected to the primary NTP. The primary NTP, it's not required to be in the same county as the MU or the MNTP, but they are holding the responsibility for continuing treatment services if the MU or the MNTP ceases to provide services. And there are some guidelines there too in that behavioral health information notice about how the MNTP must return back to the primary NTP and things like that that help guide. I know they can go to a different county, but there are some things that that help guide that geography. So looking more closely at this funding opportunity, this is round 2. So we did make some awards earlier this summer for our round 1 partners. And currently in California, there's 1 MNTP in operation and many MUs. So the program scope is to improve access in rural areas without narcotic treatment programs. Justice-involved populations, Indigenous and Native communities, and other vulnerable populations through startup funds for MUs and MNTPs. So really trying to provide those startup funds to increase access. The project will run from November 1st, 2024 through April 30th, 2026. It should be an 18-month project. So to be eligible, the primary NTP must have a valid DHCS license and remain in good standing. The primary NTP must demonstrate drug Medi-Cal DMC enrollment. The primary NTP must have a valid DEA registration, and the primary NTP must have a valid Substance Abuse and Mental Health Administration, SAMHSA accreditation. I'm noticing a few questions coming in, and they're asking a little bit about eligibility. I'm not looking at them directly, but I do want to note here that if you are not an NTP, you can partner with an NTP, but the NTP has to be the applicant organization, and they must have the valid DHCS license and remain in good standing, and they have to be responsible if operations cease. So in the development of a budget or anything else, they can certainly have funds available for partners, and can definitely include that in work plans and such, but the NTP has to be the primary applicant and the contract holder. And it's connected to the NTP's license at DHCS. So the target audience for the opportunity are DHCS licensed NTPs. They're encouraged to apply. Priority being given to NTPs that want to expand their services through an MU or an MNTP to prioritize those kind of priority populations we talked about, rural communities, correctional facilities, local DHCS licensed residential substance use disorder facilities that don't currently offer MAT, Indigenous and Native communities, and also Medi-Cal beneficiaries. So if the organization has multiple NTPs, they may apply for multiple MUs per eligible NTP. So multiple medication units per eligible NTP is allowed. But they can only apply for 1 MNTP per eligible NTP site. So if you have 3 NTP licenses, you can apply for an MNTP for each of those licenses. And you can apply for multiple MUs per eligible NTP. Each one, however, each location or vehicle needs to be a separate application. There's 2 tracks on our application to distinguish the medication units from the mobile narcotic treatment programs. So the medication units defined by federal and state law are treatment facilities from which licensed practitioners or community pharmacists dispense medications for opioid use disorder. It's usually, it is a geographically separate facility from the NTP, but operates under their license. This allows the NTP to extend their services to communities that might not otherwise have access. Track 2, the MNTP, the Mobile Narcotic Treatment Program, federal and state law defines that as a program operating from a motor vehicle that serves as a mobile component of a primary narcotic treatment program to treat opioid addiction and operates under the primary NTP's active license. So again, operating under the license, but utilizing a motor vehicle. So track 1, this is for initial startup costs for new medication units. And DHCS encourages applicants for the funding opportunity to partner with pharmacies to co-locate medication units within pharmacy settings and correctional facilities. It is not required to be within a pharmacy, but that is encouraged. Track 2, the MNTP. So it's a program operating from a motor vehicle. So this funding can be used for initial startup costs, like purchasing the motor vehicle. It cannot be used for ongoing costs. And again, 1 MNTP per eligible NTP. And separate applications. This has come up before. You can apply for both an MU and an MNTP, but they do need to be separate applications. So our funding amounts, $400,000 for the medication unit and up to $1 million for mobile narcotic treatment programs. This is a deliverable-based contract, so you will receive 50% of the award up front on the execution of the contract once we receive all your compliance documents. And have a signed agreement. We've received insurance for your organization, not necessarily insurance for the MNTP, but the insurance for the organization and all your license documents. And then you will receive 40% of the award once we have receipt and approval of documentation demonstrating the purchase of a vehicle or the procurement of your medication unit site. And then 10% will be paid based on the receipt and approval of documentation demonstrating completion of all deliverables to that point. That includes the date service delivery will begin and the ability to offer services like if you've received your license and expected outcomes for the remainder of the project. Selection criteria. How are we evaluating proposals? What will we be looking for? The most competitive applications will provide a detailed description of the proposed project. What will be done, how it'll be implemented, who will be involved, what will they do, a really clear, realistic timeline of activities and concrete measurable objectives. They'll include sufficiently detailed budgets that closely align with proposed activities. Detail how the proposed projects have organizational and community buy-in. Provide a concrete plan for incorporating proposed activities into the organization's current workflow. And be applicants who plan to work with local DHCS licensed residential SUD facilities that do not offer MAT. The most competitive applications will also propose a treatment service model that promotes the meaningful involvement of participants and works in alliance with MOUD patients and addresses stigma, racial, gender, and other institutionalized discrimination to improve care outcomes. integrate medication units and or mobile narcotic treatment program services with other parts of the continuum of care. This can include harm reduction services for people who continue to use drugs and or substance use disorder, recovery services for people who wish to utilize them. So such services may be offered directly or in partnership with other organizations. And we also just want affirmation, have your application demonstrate that you have the ability to submit regular data and financial progress reports. There are some compliance requirements under this contract. There are some insurance requirements. The insurance that's required is detailed in the RFA. We request that we receive the insurance documents within 30 days of executing your contract. And that insurance must be maintained throughout the duration of the project and renewed if needed. We can answer more questions about insurance once awarded. And then if awarded, you will have a 9-month report, so a halfway mark report and a final report. Again, because those payments are deliverable based, it's likely you'll be in communication with us prior to that, but these are the reports that are required for that last 10%. So I am going to pause here and take a look at the many questions that I see have come through. So if the organization is not an NPP, but provide medications for SUD through mobile street medicine, would we be able to partner with an NPP to qualify? Does the project have to be fully driven by an NTP? You can certainly partner with an NTP, but the NTP must be the applicant because we must have the NTP's license and everything. So there's one very specific to an organization, again, not an NTP. Again, the answer is similar. You do need to have, you would have to have a partnership with an NTP, and the NTP would have to apply. The NTP license is required for this application. Is there a round 3 funding opportunity? This is all dependent on funding availability. So I cannot say yes or no if there will be a round 3 funding opportunity, but we certainly would like there to be one. It is a priority. But it's all dependent on funds, and if you've followed the state budget, you know that funding has been challenging for the state of California this year. Within our health jurisdiction, we already have several methadone clinics in the city, and in the criteria, it says it should be places where there is limited access, such as those without NTPs. What qualifies as limited access? I mean, I think that this is all dependent on the populations that you are trying to reach. We just want to remove barriers and increase access to these medications. So I think it's all about how you present that. If you are reaching folks who wouldn't otherwise go to those methadone clinics, and you're improving access, increasing, I think, you can easily describe that. And but they just want to make sure that it's reaching those who may not otherwise have access. If you're setting up next to the methadone clinic, that may be harder to write about. Specific qualifications for jail sites. We don't have any very specific jail site qualifications. I know different counties probably have different things. So it's kind of dependent. I would hope that you would have some sort of relationship with the jails that you're hoping to serve. If you have a more specific question, let me know. If you already have an SUD program and offer MAT services, you can apply. No, you can apply. You just have to have an NTP license. If you are already an established medication unit and you're trying to apply, you wouldn't qualify because it's for startup funds, but otherwise, hopefully I'm answering that correctly and understanding the question. Would you have to do methadone on the mobile unit, or could you only offer buprenorphine on the mobile site? I believe you can only offer buprenorphine, but I will double check and make sure to answer that in the FAQ with DHCS. But they would like to require the use of buprenorphine, but not, I don't know that methadone is required. Okay, healthcare provider in San Francisco Bay Area that has MAT services primarily serve Medi-Cal beneficiaries. Though we don't specifically focus on other priority populations, yes, you would qualify as long as you were an NTP. You know that when we look at those priority populations, that is kind of how funding is prioritized during the process. If the funding ends up being competitive, if we receive more applications than funding is available, then that'll help make some of those determinations. But it doesn't exclude anybody from funding, as long as you can make the case for the need for access. Okay, it looks like the questions have kind of paused, so I am going to oh, did one just come through? What if you don't have an NTP license? May have missed an earlier response. An NTP license is required to be eligible for this funding. So if you do not have an NTP license, you could partner with an NTP and they could apply in partnership with you, but the NTP has to be the contracted entity. And if you serve multiple smaller counties, you would have to figure out contracting with each county. I mean, no, not necessarily. You could serve multiple smaller counties. You don't have to directly work with the county government itself unless you're working with the jails, and then you would need to work that out with the jails or prisons. But if you are an NTP and you wanted to work with multiple smaller counties, hopefully I'm understanding that correctly. Oh, in regards to billing Medi-Cal, yes, that makes more sense. Yes, you would have to work that out. And again, you know, because this is these are startup funds, so we're really helping you get established so that then you can do that with the different counties. But yes, thank you for that clarification. That makes a lot more sense. All right, we're going to switch gears and talk a little bit more on specifically how to apply through our grants portal. And I'm going to toss the mic over to Hannah, who will walk us through the grants portal and application.
Thank you, Madeline. And hi, everyone. As Madeline mentioned, I'm Hannah Feingold. I'm the program associate working on this project. So I just want to breeze through the application, where to find it, some nitty-gritty details about it, but it should be fairly quick. So this is what the application looks like. You can find it by going to the mataccesspoints.org website. If you scroll down to the bottom right-hand corner, there will be like a news update about this funding opportunity. And then you can, from there, there's a link. Thanks, Madeline, for dropping the website in the chat. There will be a link to the RFA. And then from there, you can find the another link to the application. And so this is what it looks like. Just one thing to note, here at the start of the application, you'll notice our email. So state opioid funding at shfcenter.org. Please do email us if you have any questions that come up. We're certainly, here to help and want to make sure you submit your application. And the red circle is just to illustrate that you can save a draft of your application and come back to it. And so what you'll do there is just put in an email, create a password, save that password, and you can come back to it as you please. Next slide. So this is just some of the applicant information that we'll ask. We'll also ask if you've got a fiscal sponsor, yes or no, and then there will be additional details that will be requested depending on if you say yes to that. In addition to the CEO, director, and application contact, we'll also ask for a program contact, and you'll have the option to add in a financial contract or financial officer contact or a contract administrator contact. So lots of folks that you can add in, but the two top would be the CEO and the application. But in addition to that, you'll have, your 501c3 status, just basics, your address, things like that, which congressional district you're in, and then your annual budget. And next slide. So then you'll put in the project information, just a brief purpose statement that's 100 words maximum of what you intend to do, kind of your thesis statement. The requested amount, again, for track 1, the mobile unit, it's up to 400,000. For track 2, the Mobile Narcotic Treatment Program, that's up to $1 million. Which track you're applying for, 1 or 2, which counties the project will impact, where you plan to serve, and then the population that you plan to serve as well. Next slide. So we asked quite a few questions for this application. They range from about 200 to 500 words in length. And just a note on technical assistance, question 11, that's not counted in your application. That's just for us at the center to kind of get a gauge of what applicants are looking for in regards to technical assistance, so we can really tailor it to what you're looking for. Next slide. So I just want to cover the attachments that are required. And you've got the proposed project budget and the work plan. These can be found in the application. There's a link. The budget is in Excel format. The work plans, you can upload either PDF or Word document format. And then we ask for your W-9, your DHCS issued primary NTP license, your drug medical approval letter, DEA registration, and lastly, your SAMHSA accreditation. And if you go to the next slide, you'll see this is just what it looks like on the application. So there will be a spot where you can upload each requirement file. And just a note, please do upload the final version only. Sometimes if you try and upload once and then again, it can cause some errors. And if you're getting an error, please feel free to reach out to us. We'll share our email once again at the end of this presentation. So that's it for the application. Again, any questions that come up, let us know. And I will hand things over to Keith Wilson, our senior grant accountant, to go over the budget.
Thanks, Hannah. So one of those attachments that you'll be uploading in the links that Hannah just walked through is the budget. Whether you're an MU or MNTP, your budget looks the same. We've tried to make it pretty easy for you to fill out. The description field here is going to be useful for us. Whatever you can put in there, especially for personnel, and helping us determine whether this is supposed to be the first 90 days of operating. So if we see a a nurse in all 3 budget periods, or both budget periods in this case, it's going to be hard for us to tell, well, is that, 0.6 FTE for the whole time, all 12 months, all 18 months, or is it just for the first 90 days? So whatever you can put in that description to make it obvious to us how you calculated that personnel is going to be helpful in us reviewing your budget applicants. Some of the other things that we saw, especially for the MNTPs, is if you need more miscellaneous line items to list out everything you need to build out that mobile unit, please feel free. Add as many miscellaneous line items as you need in order to make that budget legible for your finance folks and for us. Let's see, are any of these questions right now about the budget? No. All right, next slide, please. So our project period start is 11/1/2024. That first period end is 7/31/2025. And then we'll start 8/1/25 all the way to the end, 4/30/2026. So the 90 days of operating, that clock kind of starts once you've started operating. The admin costs can be before that. As soon as you start applying to this thing, you're going to be incurring admin costs, and that's fine to show throughout. And is there another slide there, Hannah? No. And then let me check the questions real quick.
I'm going to just pop in here because I don't think we have a slide here on allowable and unallowable costs, which
Yeah, that's
are
what I was
very
looking for.
detailed in the RFA. But so I do want to note, like Keith is referencing, is because this is for startup funds, the budget should be reflective of startup costs. And that means that regarding personnel, there are some limits in that we can only fund personnel for the first 90 days of operation. If you have personnel costs related to starting up, administrative costs, things like that, like, was looking at a budget earlier today and I was like, oh, of course their finance accountant person is going to be working on it. They're purchasing a vehicle. That makes absolute sense. That's fine. But there are limits on operational staff. So if you have somebody who's dispensing medication, you have someone who's driving a vehicle, they should only be on your budget for 90 days. And ideally your budget should say that in the description, because that makes it very clear that you understand those limitations.
And although there isn't a slide for the allowable and unallowable costs, the RFA actually does a really good job of spelling out what's in scope and what DHCS and what this award is intending to fund with this project. So track 1 MU and track 2 MNTP are both listed there. There's 5 or 6 bullet points for each. I would consider that kind of the formula for your budget. Whereas some grants you can approach, well, what's unallowable? In this one, I would say, let's just look at these allowable example costs. And although that's not a comprehensive list, it really does a good job of outlining the scope of what we're looking for.
Yeah, absolutely. It fell off my desk. Apologize if anybody heard that.
So again, that's page 4 and 5 of the RFA document itself. And then the template, which is on the screen, is the same template for both of those tracks. But please email us if you have any problems with that template and we can help you walk through it.
Anything else to know, Keith?
I don't think so.
Great. I'm going to take some more questions here. If the organization's priority population is not any of the following groups mentioned in the RFP, are we still eligible to apply for track 2? And yes, you are still eligible to apply, but please describe how you're increasing access to medication. We have previously had difficulty receiving timely replies to specific questions about the grant itself and the application. Please provide information on contacting and receiving answers to questions in a timely fashion. I want to emphasize here grace and patience during the application process because this is in partnership with DHCS. That means that DHCS must review all questions and answers for this application. Oftentimes, because especially under the MNTP track, this is a somewhat brand new program. DHCS only released their guidelines in January. So that often requires coordination with multiple departments and divisions at DHCS, including the Community Supports Division, which the funding runs through, and the Licensing and Certification Division. I know that you all probably have familiarity with working with large government systems and can understand that it can take time to get answers from the right folks. So, that being said, you can contact the State Opioid Fund's email as detailed as you can. We can't answer questions related to like really specific things about your application, like, is this okay kind of thing, but we can answer questions related to the content of RFA and how to apply and such. We'll do the best that we can, and we will also post FAQs. Please read through the RFA very carefully along with the behavioral health information notice. And we greatly appreciate your patience as we all navigate new programmatic funding. Do you have to be a 501c3 to apply for this grant? No, you do not. If you are a private NTP, you do not have to be a 501c3. Any other questions? Okay. So some tips for applying. Please submit the application before the deadline. We recommend you write your responses to the narrative questions outside of the application portal. The RFA has all the questions already listed, so you don't even have to go into the portal to see them. And then cut and paste them into the appropriate field. This way you have it all prepared. If something technologically goes wrong, you didn't lose your answers. Track your word count. Don't spell out dates. Write 10/26 and not October 26. There's some specific things here for a drop-down list. This is also listed, I believe, in the RFA. So using the control key, using the command key, depending on if you're a Mac or PC user. You can click Save My Progress and Resume Later at any time. And you can only submit your application once. So you can use the tab key or mouse click to move from field to field. Clicking enter will attempt to submit an incomplete application. You want to make sure that you've completed everything in the online portal. You've completed all the application questions. You have your proposed project budget, your work plan, your W-9, your NTP license, your Medi-Cal approval letter, your DEA registration, your SAMHSA accreditation. So double check that you have everything that you need. The application deadline is September 6th at 1 p.m. So just a note here, it's not 5 p.m., it's 1 p.m. That really does allow us to assist those with technological problems, but please be mindful of the deadline. We will review the applications in September and October, and the approximate award announcement is at the end of October. The state opioid funding at shfcenter.org is the absolute best email address to send questions to. That helps us triage questions and get them to the right place. If you put in your subject line the name of the RFA that you need help, that also really helps us make sure the right person can get to your question and assist you. We know that the portal can, technology can be challenging sometimes. Sometimes that requires the assistance of our IT department, or the portal is a part of Salesforce, our Salesforce team. So we do want to make sure we get you connected to the right place. The MATaccesspoints.org website is where we post everything. shfcenter.org is the center's website. We do have a newsletter at Sierra Health Foundation where you can sign up and you can receive. It lists all the funding notices as they come out. There's multiple programs related to drug health, and so encourage you to stay connected. Any last question? I'm not seeing any questions, but feel free to email us. Again, we will post these slides. We will post the recording. It does take a moment, so we appreciate your patience, but they do have to be fully accessible for online screen readers. So we do need to make sure that that's available before they can be posted. The same with the FAQ. So appreciate your patience. But we'll post those online. You feel free to email us if you have any additional questions. And we thank you for being here today.